Live from Town Square Towers at the heart of the Jersey Shore. Wake up with Jeremy Grunin. Get up, get out, do something. Join the conversation. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Welcome back. Wake up with Jeremy Grunin, 7:08, February 10th, 32 degrees, rolling up to 38 today. WOBM AM 1160 at 1310 News Talk Radio, streaming live on the Radio Pup app and at WOBMAM.com. 732-505-1160 to join the conversation. We are joined on the line by Dr. Najib Alturk. He is a cardiologist here in town. He is the chair of the Community Medical Center Cardiology Department. Welcome, Dr. Alturk.
Yeah, hi, Jeremy. Thank you for having me on your program.
Oh, listen, I am super excited to have you. As you are more than aware, February is American Heart Month, and so it seems appropriate that you would be joining us this morning.
My pleasure.
Cool. So I just wanted, before we get started, we do have a phone call. So let's pick up. I think we have Ralph on the line. Good morning, Ralph.
Hey, good morning, Jeremy. How are you?
I'm great. How are you?
Oh, well, we're doing well now.
Okay.
Listen, I just wanted to, it's timely that you're having this conversation about healthcare today because my wife just spent 3 days at Community Medical Center. And I have to tell you, and the reason I'm calling in is the care that she received there is first class. From the emergency room to her stay there for a couple of days. I have to thank all the healthcare professionals throughout the entire facility. It was just amazing.
Well, that is great to hear. By the way, I think this is Ralph Wolf, right? Jersey Coast Appliance. Am I right? Did I get that right?
You guessed that.
Thank you so much, Ralph. We really do appreciate the feedback, and it's good to know that we are delivering great quality health care here in Ocean County on a regular basis, right?
You know what? It's you look at the professionals that are taking care of your loved ones there, and it's a joy to see that they really do enjoy their work, and they really put their heart and soul into it. And the shame of it is that we sometimes don't even remember their names. There were so many people that took care of my wife, and I try to remember their names to go back and thank them later, but it just doesn't happen sometimes.
Well, thank you again, Ralph, and we're glad to hear that your wife is starting to feel better. So that's great news all around.
That's great. All right, Jeremy.
Cool.
Thank you.
Talk to you soon. Thanks.
All right. Bye.
Well, doctor, there we go. We have we start off with a positive testimonial about Community Medical Center. That's a good start, right?
Yeah, I think that's a good start. And I have to tell you, from prospect of a patient, my mother-in-law in the hospital right now at Community Medical Center, and she is receiving the best care. As you know, I'm not seeing the patient 24 hours, but seeing how the care delivered by the nursing staff and the hospital staff really show me how great they are.
Oh, that's
and
awesome.
I'm very thankful.
That's great. So help us out a little bit, because I don't think a lot of folks really have a great grasp on what some of the signs and symptoms of heart disease look like. I'm sure we all know when our elbow hurts or when our leg hurts or when we bruise something, but I don't necessarily know we can all identify some of the signs and symptoms of heart disease. So you can help the listeners out a little bit, possibly?
Yeah, actually, the heart disease symptoms is very confusing sometimes. Some people think it's, I would know if I have a heart problem, if I have a chest pain. But frequently, people present with other symptoms, such as extreme fatigue, dyspnea on exertion, dizziness, sweating, nausea. So those kind of symptoms could be confusing. And sometimes even people have a heart disease and they don't have any symptoms to be detected. But also women usually have a different, or not usually, but frequently they will have a different symptom from men.
And what do those symptoms look like?
I mean, mostly women present with fatigue, dyspnea on exertion, dizziness, lightheadedness, not necessarily having chest pain. People could have jaw pain, neck pain, arm pain, upper back pain, those kind of symptoms. Also, to bring a point, women sometimes present late to the emergency room to take care of themselves. And this is due to the emotional state. Women like to get everything ready and set up for the family before they go. God forbid, the dishes are not washed or the vacuum is not done. So there's delayed in the presentation also.
So that's an interesting point because my wife is a registered nurse and on her way to her master's degree. And so the first time I have a pain anywhere, I am carted off to see a doctor. But she could be unable to get out of bed for 3 days, and she's fine and not doing anything about it. Is that so? That's not unusual. Then I'm not in an unusual circumstance, I imagine.
Exactly, and people also don't know heart disease is still number one killer in women, even more than all cancer combined. There's 1 in 3 women died of heart disease.
Oh. Okay, and is there any role of genetics in heart disease? Does that have anything to do with it?
Of course, family history is a great factor, and also beside having hyperlipidemia or high cholesterol, that also could be genetic and expose people to have a heart attack. So genetic is one of the big factors.
Okay, and so let me ask you: this is something that's very topical for me at this point. Could sleep or sleep deprivation lead to any kind of heart disease?
Absolutely. Actually, sleep deprivation, there's a new study I read. People who sleep less than 5 hours a day, they have a great increase in incidence of heart attack and heart disease. They also increase the risk of having high blood pressure, increase the risk of all cardiovascular disease combined. Besides, people could have a sleep apnea, which is another sleep disorder. And that also could put you at risk of having high blood pressure, heart disease, sudden death, and also increase the prevalence of arrhythmia, such as atrial fibrillation and pulmonary hypertension. So that needs to be treated. And there's a lot of things we could do to prevent heart disease, even if you have a genetic predisposition to have a heart disease. There's a lot of things you could do to prevent heart attack.
All right, doctor, I'm going to ask you to hold that thought because you have created. You've been on the radio before, haven't you?
No.
Well, because you just created your own teaser for when we come back from the break. That was very adeptly done by you. So when we come back with Dr. Alturk, he's going to tell us ways that we can help prevent heart disease. Dr. Najib Alturk, cardiologist, Community Medical Center. Be right back.
Now, back to Wake Up with Jeremy Grunin. News Talk Radio WOBM AM 1160 and 1310 and WOBMAM.com.
Welcome back. Waking up with Jeremy Grunin this morning. I know, little frightening, little creepy. It is what it is. February 10th, 32 degrees, WOBM AM 1160 and 1310 News Talk Radio, streaming live on the Radio Pup app and at WOBMAM.com, 732-505-1160 to join the conversation. On the line, Dr. Najib Alturk with us. He is the head of cardiology for Community Medical Center, board-certified cardiologist here in town. And as he so skillfully teased on the way out into our last break, Dr. Alturk, you're going to talk to us about preventative measures you could take to prevent heart disease.
Okay, Jeremy. We have actually 2 types of risk factors. There is modifiable risk factors, and there is risk factor you can't do anything about. If you have family history, for example, there's nothing you could do about that. Or if you are male, which is you carry a higher risk of having a heart attack, you can't do anything about that. However, there's a lot of modifiable risk factors, such as high cholesterol, obesity, physical inactivity actually is a big risk factor, alcohol, diabetes, high blood pressure, and smoking. However, if you have a risk factor, don't be disheartened. Control what you can control or you have control over. And just to know, there's a recent study shows also people who are physically fit controlling their risk factor very well, they have a 40% less chance of dying of a heart attack if they have one. So there's a lot of things could be done. The diet, people should follow a low cholesterol, low saturated fat, and trans fatty acid diet. Minimize the amount of red meat in your diet. Eat a lot of fruit and vegetable. Limit the amount of sugar in your diet as well, especially with the beverage, which is high in sugar. Exercise daily. I would recommend, however, based on a recent recommendation by the American Heart Association, for the optimal level of exercise 150 minutes a week, which is not a lot of time, but it will give you an optimal result. Also, you could mix cardiovascular or aerobic exercise with resistant exercise. And also, you should discuss your cholesterol with your physician. And if you're smoking, you should stop smoking. You should join smoking cessation programs, which help you to a great deal. Also, diabetes. Diabetes actually is a great factor. People with diabetes have 2 to 3 times higher risk of having a heart attack or stroke than average population. They are more likely to die of a heart attack, and often they have silent symptoms.
Okay. Well, listen, so I took some good news there. So number one, the good news for me is that my wife and I have been working on a resistance program for the last 15 years. She resists everything I ask her. I resist everything she asks me. So we've been definitely working out strong. I feel good about that. I also I like how you threw in. I got your joke there, by the way. I don't even know if you know that you did it, but you said don't be disheartened. So I see what you did there. You were like, don't be disheartened, and we're talking. You're very witty. I see you're playing with us now, Doctor, but it's okay. It's all right. Good information. Let me ask you a question, because this is what's really important.
Yes.
If I drink wine, red wine, are there benefits for me?
Great question.
Okay, good.
Great question. In fact, a study shows 1 glass of wine, small amount of alcohol, helps to reduce heart attack and heart disease. And in fact, it will raise your good cholesterol, which we haven't discussed. It will raise your HDL, which is a high-density lipoprotein, which is a good cholesterol. And drinking a little amount of alcohol is good, but there is difference we have to notice between men and women.
Right.
Men handle alcohol much better than women.
Duh.
For women usually cannot tolerate more than 1 glass of alcohol a day. More than 1 glass of alcohol will cause a problem.
Right.
Men could handle 1 to 2 glasses a day. So a small amount of alcohol is good. However, excessive amount of alcohol will cause a lot of problems. You know, alcohol is directly toxic to the heart muscle if it's taken in a large amount, and also cause your blood pressure to be elevated and cause your lipids to be also disturbed, like having high triglyceride and high lipids.
Gotcha.
So the amount really has to be very specified with alcohol.
Awesome. Dr. Najib Alturk, board-certified cardiologist, chair of the Community Medical Center Cardiology Department. Doctor, thank you so much for joining us this morning.
You're welcome. My pleasure.
All right. You were great. I'm going to research whether I should be drinking Cabernet, Merlot, Malbec, Pinot Noir. And obviously, I feel like more alcohol will definitely prevent a heart disease better for me. Back after this, Wake Up with Jeremy Grunin.
Wake Up